Welcome to the 2018 Connecticut Breast Health Initiative Grant Award, Sponsor Thank You, Fundraiser, and Volunteer Appreciation. We're actually introducing a new award this year, the Norma Cachillo Pink Ribbon Youth Award. Our honorees are the third generation of CTBHI volunteers. The Tucker family has been very giving of themselves for over 15 years. Connecticut Breast Health Initiative recognizes Linnea Tucker and McKenna Tucker. I'd like to give you something. CTBHI recognizes tonight a breast cancer survivor as our 2018 top pledge collector for raising $5,581 all on her own. Linda Carroll. Come on up. And these fundraisers, we're just doing the people who raised over $1,000 for us. Elaine Garrett from Microcare. New sponsor. Dr. Christina Stevenson from Yukon Health. Home Depot has done forever, has done the Build in the Park on race day. 1997, wow. Ron's been with us for more than 15 years, and I know you have the total in your head.
Yeah, you do.
Yeah, you do.
15 years, Connecticut USA Car Show, we have donated $210,000.
Decisions on CTBHI grants are made by the Board of Directors. But those decisions are based on the work and the advice of the Grants Committee. The charge of the Grants Committee is to make solid and substantiated recommendations to the Board for its consideration and action.
We would like to present the first grant tonight to Yukon Health. This grant will fund the genetic counseling outcomes study being undertaken by Dr. Keith Belizzi, the principal investigator of the study, along with Kate Dibble, the study's research coordinator. The purpose of their work is to identify approaches to genetic counseling and to support women and their families following the results of a positive BRCA test result. We have with us tonight Kate Dibble. I
am Dr. Belizzi's PhD student, and I act as a study coordinator working on this project. Our project specifically focuses on the patient experiences with and outcomes of genetic counseling for specific gene mutations, BRCA1 and 2. On behalf of the entire project team, I thank you and the grant committee.
Our second grant tonight goes to Stanford Health in support of their high-risk breast cancer program. Stanford's program intended to delay or prevent the onset of breast cancer by identifying those women at high risk is under the leadership of the program's two co-directors, Dr. David Gruen and Dr. Helen Pass. along with Barbara Carr, the Director of Women and Children's Services at Stanford.
At every single mammogram, every woman at every mammogram when they come to one of our centers, she is given two risk assessments. So when we do these risk assessments, they're based on family history, personal history, whether or not a woman has had any breast biopsies, the age of her first period, whether she's had children and the age that she first had a live birth, and there are other breastfeeding, there are other factors, and they all go into this and outcomes her risk. The interim care coordinator called me just about a week ago and said, we have now had our second case of breast cancer identified as a result of 2 women being called that otherwise would never have been called. And it's at a very, very earliest stage. So they have super fantastic odds of completely beating it. So I just want to say on behalf of Stanford Health and my colleagues that we're so grateful for this grant, and we look forward to bringing you those outcomes and letting you know what they are, and most importantly, to helping more women win in this fight against breast cancer. Thank you.
My name is Ashwin Reddy, and one of the second-year fellows at UConn. I work with Dr. Tannenbaum, and we are both doing this breast cancer research. So first of all, I want to thank the initiative for believing in us and giving this grant. And so we know that the cancer treatments have changed, and we are talking more about immune-based therapy and personalized cancer treatment. Some cancers are early cancers, some cancers spread to other parts of the body. But we don't know exactly how this happens and who has cancers which spreads and who has cancers which is localized. What this does with our other study is we are going to compare the presence, absence, or disappearance of these circulating tumor cells with their genetic makeup and see if there's any correlation so that we can predict that these patients are going to have circulating tumor cells and some patients who are not going to have circulating tumor cells. So this is what is our study program. And again, our thanks to the initiative for the grant. Thank you.
There is one integral person in this room that we have not thanked tonight formally, and I want to say thank you to Michelle Lewitt. Yes.